Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Anna Stansfield. Thanks for joining us. Tonight, we take a look back at stories from our health team, from efforts to include more diversity in medical research projects to how communities are working towards better air quality.
Over 100,000 people are awaiting an organ donation in the U.S., and the vast majority are patients of color. Cronkite News reporter Milan Andrade takes a closer look at disparities in organ donation and why advocates are urging more people of color to register to become donors.
No one ever plans on hearing that they need an organ transplant. But in 2016, Gerardo Huerta and his wife Rocio Munoz learned that she suffered from a kidney disease and would need a new kidney to survive.
It's very difficult when you receive the news that your loved one is sick and needs an organ donation.
As his wife's disease progressed, Huerta quit his job as a truck driver and started working for the National Kidney Foundation of Illinois. Today, he serves as the outreach coordinator, working to encourage Hispanics to register as organ donors to help eliminate disparities between those who need organs and those who donate. Nico Santos, the media relations specialist at Donor Network of Arizona, also encourages Hispanics to register as donors to help others in the community.
When you register, there is a slightly higher chance that you'll be helping someone that looks like you or lives in a neighborhood like yours or speaks the language that you and your family and friends do.
In Arizona, 1,600 people are awaiting a transplant, and roughly 31% are Hispanic. Nationally, about 60% of the 106,000 people awaiting an organ donation are people of color, and the vast majority are waiting for kidneys. But among those who have donated organs since 1988, 70% were white, 13% black, 13% Hispanic, and nearly 3% Asian. Unfortunately, some transplant stories do not have a happy ending. But on Christmas Day in 2019, Gerardo's wife, Rocio, finally got her kidney. Today, the couple do what they can to persuade others to become donors.
To donate life or to give the gift of life, it's the greatest gesture of love for another human being.
In Phoenix, Milan Andrade, Cronkite News.
If you or a loved one are interested in becoming organ donors, you can visit organdonor.gov for more information.
More than 50,000 people in Arizona are part of a national effort to build a new kind of medical database. To recognize that achievement, Governor Doug Ducey proclaimed March Arizonans in Health Research Month. Cronkite News reporter Anna Stansfield tells us why this program is so different and how it could help experts study any number of health conditions.
The All of Us research program is an initiative of the National Institutes of Health, and its goal is ambitious: to build the largest and most diverse database of its kind. The idea is to include people too often overlooked in medical research, those with different ages, races, backgrounds, living in all parts of the country. Here in Arizona, the University of Arizona and Banner Health are heading up the effort. Victor Avila is Latino, gay, and HIV positive. After learning about the All of Us program, he wanted to enroll because of the diversity he brings to the table.
I just felt an obligation personally to be part of the study so that I can help make some kind of a difference. And maybe when I get to that aging part, there's going to be better medicine, more advanced healthcare, and just an opportunity for me to lead a better overall healthy life.
Nationally, All of Us aims to enroll at least 1 million participants who agree to share their health data. Approved researchers can then access that data to study a host of different health conditions. For example, Arizona researchers are using the information to re-examine the link between cholesterol and heart disease.
We're excited to provide a shared resource of electronic health record data, other health information, detailed genetic data, and biological samples for the field, for researchers throughout the country.
Too often, health research fails to reflect the nation's diversity. People of color, those with disabilities, and others can get left out, and that can affect how treatments are developed and distributed.
Most of the genetic information we have is on individuals of European ancestry, and so primarily white populations of individuals. And by including more diverse populations, we increase the amount of genetic diversity that's within the data set, and that enables enables additional discoveries.
For now, anyone 18 and older and living in the U.S. may enroll. Participants simply share basic information like their name and address and any electronic health records they may have. Then they can schedule an enrollment appointment to provide vitals and potentially a blood or urine test. To date, Arizona leads the nation in program enrollment. Avila was the 50,000th participant.
My winning prize for that is learning more about what my health is and how I can improve it, and just learning more about, things that I would otherwise not know about.
All of Us is committed to making sure health information remains private. Personal information that could identify someone is removed before the data is shared with researchers. In the newsroom, Anna Stansfield, Cronkite News.
What started as a pharmaceutical drug used to treat severe pain has now become a leading cause of overdose, and death rates are only continuing to rise. Cronkite News reporter Madison Thomas spoke to individuals in all different fields to learn why this is happening and what should be done about it.
According to federal data, there was a national increase of roughly 20,000 overdose deaths involving synthetic opioids from 2019 to 2020. Fentanyl is believed by many to be the most dangerous drug in America.
I've been in law enforcement for well over 25 years, and this is the most terrifying thing I have seen is this fentanyl crisis.
Fentanyl can be up to 100 times stronger than morphine. The DEA reports that 4 out of every 10 pills with fentanyl has a potentially lethal dose.
They think, oh, it's a little pill. It can't be that hard. It looks like an aspirin. I'm going to take that. And it could be deadly.
Arizona State Senator Christine Marsh sponsored a bill last year that legalized drug test strips, which tell people what is in the pill they are taking. This came after she tragically lost her own son to a fentanyl overdose.
His death had a huge effect on the direction I was going with legislation.
Senator Marsh says her son was not a drug user. He traveled down to Tucson with some friends where they believe he purchased what he thought was a Percocet.
Landon would want, like, me or, his death. He was so practical. I think he would want, his death to potentially result in something positive.
Making test strips illegal has helped the organization Shot in the Dark legally be able to supply them to people in need.
It makes people feel a little safer testing stuff and being like, okay, there for sure is, right? It might sway the person to use a little differently or a little safer at that point.
Shot in the Dark is a syringe service program that travels across the Phoenix area, providing people with harm reductive resources.
We're not focused on abstinence or anything like that. Our job is to keep people alive long enough for them to reach some form of recovery.
Jonathan Martinez says that addiction can happen to anyone.
It could be a soccer mom. It could be assistant chief of police. It could be anybody. Just because it's not happening to you directly does not mean that it's not happening everywhere around.
Dr. Foster Olive believes a strong step in combating this opioid epidemic is to find new forms of pain relievers.
I think in terms of if there was some sort of way to create a very, very good pain reliever that is not addictive and not necessarily an opioid, maybe it's a different molecule that which we don't understand how it works, but it somehow doesn't interact with the brain mechanisms of addiction.
One common message rang loud and clear from everyone. All it can take is one time.
One pill can be a death sentence. I'm living I'm living that reality.
If you are struggling with addiction and need help, the Arizona Department of Health Services hotline number is 1-888-688-4222. In the newsroom, Madison Thomas, Cronkite News.
A group of Hispanic women from Phoenix participates in a workshop to prevent respiratory diseases in their families. Cronkite News reporter Valeria Rodriguez tells us why their work is making a difference in their communities.
Minerva Velarde has been a volunteer at Unlimited Potential for the last 7 years and teaches the community about asthma.
We explain to them what asthma is, what are the symptoms, what having asthma means, and how it is related to the environment.
According to the ASU Global Institute of Sustainability and Innovation, 16% of children under the age of 19 who live in a low-income Latino neighborhood in Phoenix have been diagnosed with asthma. This is twice the national average. Unlimited Potential also focuses on other factors that contribute to respiratory diseases.
Prevention of tobacco so that people become informed if they ever have a question or wonder why things are happening to their body. The health promoter is educated enough to give them information.
According to the State of Air 2021 report, the Phoenix metropolitan area is ranked 5th in the nation for the number of unhealthy ozone days.
Palo Verde trees just like this one right here are being planted in South Phoenix to help clean the air. They need minimal water, which is perfect for the Arizona desert.
After learning more about overall health, they spread the word into their communities, creating a network to keep them informed to find alternate solutions.
We look for resources so that trees can be planted in this area and water fountains.
Unlimited Potential provides these classes in Spanish twice a week. In Phoenix, Valeria Rodriguez, Cronkite News.
LGBTQ teens are more likely to experience symptoms of depression, according to health experts. Cronkite News reporter Liz Flores spoke with one young man who is opening up about his own struggles in order to help others.
His childhood was tough. This young person says he was bullied because of sexual orientation, but he didn't give up fighting for who he is.
Carlos Maldonado was 6 years old when he realized he was not like his classmates.
Like I could sit there and giggle and laugh at the girl, but when I would giggle and laugh at the boy, I would get butterflies in my stomach.
He remembers that his peers did not accept him and bullied him to the point where he felt alone.
There was always some kids that always knocked me down. They would always call me names. I just make fun of the way I dressed just because I just was always thought out of the box the way I dressed.
The Anxiety and Depression Association of America indicates that LGBTQ+ teens are 6 times more likely to experience symptoms of depression than their heterosexual counterparts.
Higher risk group.
Chief Medical Officer at Sounder Mind, Doug Newton, emphasizes how depression can affect someone beyond the scope of what many generally think.
Anger or just not being able to sleep or having not any energy.
A 2021 report from the National Survey on LGBTQ Youth Mental Health indicates 40% of LGBTQ seriously considered attempting suicide in the past 12 months. Newton encourages those with depression or other mental illnesses to not suffer in silence.
Making sure that honor yourself and seek the help because it is out there. And these are very treatable. And it's really good to understand for many people that it is on the increase and unfortunately is very common.
Mental health expert says that it's important for people suffering from any mental illness to find a provider that understands the connection between sexual orientation and mental health. Maldonado was able to recover from depression, and now at 22, he says he is very happy with who he is.
I was able to stand up for myself. Everybody knew who I was and exactly.
With his story, Maldonado hopes to send a message to people who may be suffering from depression or other conditions that there is help available. In the newsroom, Liz Flores, Cronkite News.
April marks Sexual Assault Awareness Month, a time when survivors, families, and advocacy groups work to raise awareness surrounding sexual violence. Cronkite News reporter Liz Flores explains how a local workshop is helping women to overcome their traumas.
Sexual assault survivors shared their stories in the workshop De Colores a Chicanos por la Causa.
All kinds of different people to kind of help them work through different kinds of trauma and work towards a little bit of healing or empowerment.
Kate Chisholm is one of the instructors. She focuses on helping survivors navigate through their past and current trauma.
Just different ways of connecting with survivors where they don't have to speak of their experience necessarily, but still can find a way to work through and process some of the things that they feel around it.
They use different techniques like drawing and molding to help alleviate their pain and frustrations.
How she's able to use clay as a medium to really get in touch with other people and understand their trauma better.
Leticia Lauri Garcelaso is also an instructor and a sexual assault survivor. She understands the gravity of the issue and the importance of victims speaking out.
We know it's hard. We know it's hard to somebody believe you or maybe listen, but we are here.
If you or someone you know has been a victim of domestic violence, call the Arizona Coalition to End Sexual and Domestic Violence helpline at 800-782-6400. You can also reach the New Life Center at 623-932-4404 or connect with them on Facebook.
One program is helping mothers and their families in Navajo County. Cronkite News reporter Molly McBride explains how this program works and why it is making a difference among low-income families.
The Mama Project helps moms experiencing barriers get ahead. One of its main goals is to move them from poverty to prosperity.
1 year ago, Kelsey Callahan was struggling to feed her family, homeless with 2 young kids.
I'm not looking for a handout. I've always been very independent, but I just kind of needed help being steered in the right direction.
Callahan was working at a coffee shop in Pine Top when she heard about the Mama Project. She applied, interviewed, and was accepted into the program that same day.
I was very alone and in a dark, depressive state. And coming here, I met one of my best friends.
Women 25 to 35 years old and children ages 6 to 11 make up the 2 largest demographics living in poverty in Navajo County. The Mama Project gives single mothers living in poverty the support they need to get back on their feet.
The mental health component of having other women who are going through the same things that you're going through is really helpful.
Mama Project Program Coordinator Molly McGavick can relate to the moms on a personal level. She was a single mom in Navajo County and struggled to provide the basic needs for her and her children.
Having something like this program when I was a single mom would have been super beneficial for me.
In this building right behind me, single mothers will gather every week for class, all with the same goals: to better their lives for themselves and their children.
They get to know you and your struggles, and they help you survive it and keep your children by your side. This program helps you realize that there are actual people out there that want to help.
The Mama Project is a 1-year program. It focuses on helping moms achieve stability for their families by connecting them to a community of moms going through the same struggles. They help moms find jobs, medical and mental health resources, and childcare. Callahan graduated from the project last year, and her life has changed drastically.
Through this program, I went from homeless and barely making any money to making good enough money to survive on and having my own home for my kids and myself. So it's crazy.
That's it for this special edition of Cronkite News Tonight. Thanks for joining us. Break It Down is next. For top Arizona stories anytime, go to cronkitenews.azpbs.org.